Welcome, everybody, to show number 15. I'm Dr. Sal Pacella from San Diego, California, La Jolla, California. I'm joined today by Dr. Sam Rhee from Paramus, New Jersey, and Dr. Sam Jejurikar from Dallas, Texas. If you see on our screen, these are our Instagram handles, at Sam Jejurikar, at San Diego Plastic Surgeon, and at Bergen Cosmetic. How are you guys doing?
Doing wonderful, Dr. Pacella. How was life up in the International Space Station?
Oh, it's fantastic. And listen, I wanted to let you know that I invited a special guest today. Okay, I'm gonna bring him on.
Buzz Lightyear, you know Buzz Lightyear.
Nice.
He's happy to be here. He says, you know what, Dr. Jejurikar, today we're going to be talking about circumferential abdominoplasty. So let's go straight to our disclaimer. This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based on the circumstances, situation, and medical judgment. After appropriate discussion, always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something in this show. I'm going to hand it back to Dr. Pacella. Thanks, Buzz. I'm back.
I've never heard a better disclaimer. Wow. The gravitas is amazing. Exactly.
Just for our viewers out here that may have not caught our last show, I've got a new laptop, and unfortunately, I did not test the webcam prior to our last broadcast, and it's making it look like I'm in outer space. So,
oh, he's
and now he's frozen. Well, while he is frozen, it is quite interesting because he actually told us that he was going to get a new webcam after the last show, but yet here he is, and now he's got a bad webcam and some bad internet connection.
The moon is a really far place to be. That's all I can say.
Right. Well, I'm fairly confident he will be back to join us. But our topic for the week is going to be kind of a continuation of things that we've talked about before, which has been body contouring surgery. And we had a previous episode where we talked about tummy tucks, and so we thought the next evolution would be, tummy tucks are traditionally thought about for women that have had children, but there's a whole large subsegment of patients who have lost massive amounts of weight, who need even more invasive body contouring procedures. And while we're waiting for Dr. Pacella to join us, do you see a lot of these patients in your practice, Dr. Rhee, in New Jersey?
I do. There are a couple specialists who do a lot of very large body contouring procedures. And so I will do some, but I generally see patients who are really looking for a big one-shot deal where they want a lot done at one time. And sometimes working with specialists in that situation can be helpful.
Yeah. And I think maybe you might be in a slightly more fit area of the country on the whole than I am. I'm not sure, but in Dallas and in Texas in general, there is a large number of obese patients, and as a result, the bariatric surgery market has gone through the roof. So it is not uncommon for me to do one of these big body contouring cases a week. I mean, they're fairly common, and so I'll load up our presentation. I assume Dr. Pacella is going to come back and join us, but in the meantime, let's see if we can get this loaded here. All right, and let me know if you can see this.
Yes.
Perfect. Okay, and I will warn everybody that I can't see the other two guys while I'm doing this. So will you guys just give me a cue when Dr. Pacella is back?
Yes, I will.
Okay.
He's back.
So as we have sort of talked about, massive weight loss, which let's say for the purposes of this podcast, we can define as say 50 pounds or greater. It's amazing from an overall health benefit. you can see improvement in diabetes. You can see improvement in heart disease. You can see improvement in energy levels when you lose massive amounts of weight. But you can also see massive amounts of extra skin. And so you don't tend to see a lot of this on the internet. Last night, as I was getting ready for this, it was actually interesting to me how few articles you see that aren't on plastic surgery websites about the results of massive weight loss. But the fact is when you lose massive amounts of weight, you get a profound amount of sagging skin. And you can see it throughout the body. It can be the face, it can be the arms, it can be the trunk, which is the tummy and the back and the love handles and the buttocks and the thighs. And so patients will come in kind of, hey, okay, I've lost all this weight. Now what do I do? And they'll ask for you, for your approach. And so one of the things you had mentioned, Dr. Rhee, was that patients are looking for a one-shot deal. So when you see one of these patients in your office, do you propose that you do everything to them all at once?
It depends. I think there are some specialists out there that will do it all. They'll do a circumferential, they'll do the brachioplasty, they'll do the thigh lift all in a single setting, which can be quite an undertaking. If I'm going to be doing a patient such as this, I generally will piecemeal it, just because I generally focus on one area at a time. But I can see the disadvantages and advantages of working both ways.
Yeah, I'll talk to them in general about trying to do it all in about 3 stages. And I have a preferred order in which I do it, which the first one's going to be a circumferential body lift, which is what we're going to talk about today. Then later on, I'll do the arms and the breasts.
Sal just rejoined us. He's back from space.
Dark side.
I'm not sure what happened here. The internet just went down. It was
well, generally when you go across the dark side of the moon, the
that's what I was going to say.
The self-perception sometimes goes down.
I must have been orbiting around a major asteroid planet.
Yeah, is that what you were going to say?
Yeah.
Mars ain't the kind of place to raise your kids.
No, definitely not. Well, you haven't missed much. Basically, we started in talking about how you can develop massive amounts of skin excess when you lose weight. And what I had just asked Dr. Rhee about, and I'll get your opinion, is when you see a patient in your office who has lost, let's say, greater than 50 pounds or 100 pounds, and they come to you and their face has fallen, their arms are droopy, their tummy is saggy, they've got a sagging butt, their upper back has a bunch of skin, their inner thighs are full. How do you approach that patient? How do you tell them you're going to take care of their issues?
Right. It's a good question. I think, first off is I try to spend a significant amount of time talking about what their expectations are. And this really gives me an understanding of what they expect to derive from the surgery. Okay. And sometimes, with weight loss, there's a huge psychological component to weight loss as well. Patients are, when they're super heavy and they go down to a thinner size, although it's extremely helpful for their health, sometimes they're just simply not happy with their body appearance. So I'm really trying to tease out exactly what their expectations are and what they want to obtain from this. And so let's just say for argument's purpose, it's a head to toe thing. For me, in San Diego, I usually want to start at the keystone area of the body. And to me, that's the central abdomen, and build out from there. The reason being is I found if I do things in a different direction, let's say we did the breasts first and then went to the abdomen. Oftentimes what I'm doing on the body can pull down what's happening in the breast. Same thing goes for the thighs. It could be a mutually opposing vector of force when we're tightening things up. So I usually want to start centrally in the body and work outwards.
Here. I completely agree with that. And that is my approach as well. Almost always I'll want to start with the central abdomen. I actually think there's a benefit for the thighs when you do that as well, which leads us well into our case. So this is a patient who came into my office a few years ago, who had actually lost, I think 80 to 100 pounds after having had a I want to say a gastric sleeve. And she was, we'll leave out the other complaints that she had, the other portions of her body, and let's just focus on the central abdomen. She didn't like the fact that she had profound skin excess on the back. She didn't like the fact that she had a relatively square body frame. She didn't like the fact that her tummy was sagging and drooping. How would either one of you guys approach this patient? What would you recommend to her that we do for her?
Well, certainly an abdominoplasty is something I would be discussing with her right off the bat. She has a lot of skin laxity and excess in the belly. There's a lot of bulging there. In some patients, you do that, and we talked about this previously, and then you do liposuction in the back to help address the love handles and so forth. But in this particular patient, she has some significant skin rolls in the back as well. So even if you were just to do liposuction, which you could, and you could probably get a reasonable result, she's going to have a ton of excess skin rolls in the back of her, in her back, which will persist with just liposuction there.
And you said, what was the extent of her weight loss, and how did she lose the weight?
I want to say it was somewhere between 80 to 100 pounds, and it was through a gastric sleeve.
Mm-hmm. Okay. So, interestingly enough, she looks like a patient who actually has moderately good skin elasticity compared to a lot of massive weight loss patients that I experience where their skin is paper thin. So, looking at her back area here, she doesn't have the extensive amount of stria that she has on the sides. But even, when we look at massive weight loss patients, she surprisingly has very little skin effect here. So I think this is somebody that's going to do pretty well with posterior liposuction, particularly in those upper fat rolls, as opposed to, say, doing a circumferential abdominoplasty to directly excise those rolls. Now, the other thing I think to keep in mind here is the rolls just underneath the bra fat area are actually in a different position than the ones that are on the lower abdomen or flank area. So why that's important for us is if we try to do a circumferential tummy tuck and we don't release those little fibrous bands in between those two rolls, things come out looking very odd. So for me, I think I would approach her with some aggressive liposuction to the back and bra fat area in addition to straightforward abdominoplasty. I don't know if I would go so far as to do a circumferential.
Interesting. Okay. Well, obviously we know by the topic of today's talk what I ended up doing. So this will be good. It's good for the viewers to see that you can have plastic surgeons, all of whom I think are good. I'm going to give us all the benefit of that doubt, who have different approaches to the same issue. So I want to explore a little bit in terms of what you were saying about her skin elasticity on the back. So when I looked at her, I thought, when I looked at her flanks, that she had substantial stria all the way across the side here, which you can see in this shot, second from the left, that she had two distinct back rolls. And they do have fat in them for sure. There's still some residual fat in there, but that her skin was really mobile and loose. And the benefit that I had is when I could grab a hold of her, I could slide that around. Even though it looked relatively dense, I had the benefit of actually being able to feel her, and it was mobile. It moved around on her. And so I actually came up with the conclusion that that liposuction as a standalone treatment on the back would not be enough. I do think you make a very important point, though, which is even if you're not doing a body lift on this patient, even if you're just doing liposuction, release of these bands that cause that dimpling is really, really, really important. If you don't do that, you will be left with this shape. So you can do it openly, or you can do it with liposuction in the manner that Dr. Pacella is discussing. And and it really comes down to a trade-off. I think you would agree that you can get better skin tightening with a direct excision than you can with liposuction. It comes down to what the patient's overall goals are. In some patients, avoidance of scars is of paramount importance. In other patients, Not having any excess skin is of paramount importance. This patient was in that latter category. So knowing that this patient wants to wear relatively tight clothing where they don't see skin rolls, would that change what you would do in this patient?
Probably. Some patients are just simply willing to accept a little bit of skin redundancy in the upper back and flank area to avoid a bigger scar on the back, I think, or a bigger operation that may cost us a substantial amount more. I mean, the other thing to keep in mind here is, what to dovetail what we talked about at the beginning of the or just a few minutes ago about starting from centrally and going out to the rest of the body. We're sometimes talking about 4, 5, 6 operations sometimes for massive weight loss. That comes at tremendous cost to patients and tremendous recovery. And many patients may not simply have those resources. So I really tried to talk through with them on a plan on what this is going to entail for them financially.
Dr. Rhee, I'm curious about your treatment of the flank region. What you think the relative differences would be in this patient if you were to do, say, an extended tummy tuck with an incision that goes all the way across, relative to doing a body lift, and the overall correction you think you could actually achieve?
That's a really good question. As you said, this really hinges on the patient's expectations. Are they looking for a home run, a triple, a double? I think there's a lot of, like you said, lateral skin excess here that you're going to have to take that incision beyond the hip and take it a little bit farther. And even with that, you may find yourself chasing skin redundancy, like that excess, even farther out. That's something that I'm going to sit there and sort of hash out with the patient. Do we go back and do some touch-up stuff later, do a big one first and then a smaller one later? Do we just go ahead and bite the bullet and go, circumferential with everything? This is something, if a patient says, I want the most aggressive procedure, I want the thinnest, most hourglass appearance that I can get, you can't get that with just sort of widening the incision a little bit farther. You're going to have to keep going and keep going and keep going with that. And that's really the only solution for that sort of goal.
Dr. Pacella, in San Diego, how many times have your patients come to you and said, I want to look snatched? Have you heard that term? Because I hear that term every week. Snatched. They
haven't heard it.
You haven't heard it.
Oh my God.
No.
I hear it all the time.
I hear it every week.
Girl, I am snatched.
Yes.
I want to be snatched.
Please explain.
Snatched is the patient's way of saying that they want a dramatic change in their waist to hip ratio. They basically want to get dramatic curves, and they want their waist to go in and to have a much curvier body shape. And so that's what this patient wanted. She wanted to be snatched. So we'll skip to the chase. I ended up actually doing a body lift on this patient. And as has been the case in previous podcasts, I use this educational program called TouchMD a lot in my practice. So these are images taken from there. But in the dotted lines is the way this is traditionally designed. The incision is much lower, and it comes across the entire waist. It used to be called a belt lipectomy. And I don't think this is really the way that people will tend to design it as much anymore. The rationale being nobody wants to look straight. Everybody wants to look curvy. So as a result, we cheat the incision upwards. So it's much like a tummy tuck when we're up. If you're looking in the upper right-hand part of the screen right here, but instead of ending the incision, you come all the way around the waist. As you come across the side here, you take out this belt of tissue. And this is a big operation. As these guys have already alluded to, their hesitancy in doing it has to do more with the burden on the patient in terms of the recovery that's involved, the longer period of time that's involved, the fact that we keep these patients overnight, maybe 2 nights when we do this, and there's a lot they need to do to get ready. So the big things that I sort of tell people that they need to do before surgery have to do with a lot of things. The first thing is, for any operation, it's important not to smoke. But for these huge body contouring operations, it's important to avoid secondhand smoke, tobacco products of any kinds, vaping, electronic cigarettes, anything for at least 4 weeks ahead of time. Even a microscopic amount of tobacco or nicotine products in the bloodstream can cause profound catastrophic wound healing complications. And I tell patients, if you fall off the wagon, if you have one cigarette during that time, it could be a catastrophe and you need to let us know so we can postpone your surgery. I also find, and I'm curious if you guys do this as well, that protein supplementation is a huge thing before big body contouring operations. And this could just be as simple as a tummy tuck. In our practice, we have them use this thing called Impact Protein on the left here, which is actually a surgical protein drink. It's really easy. You just tell them to take it 3 times a day for 5 days before and for 5 days after. And it has a huge impact on the ability to minimize wound healing issues. We have the scale over here just to show that it's important that you need to be at a stable weight when you have your surgery. I don't tell people what weight they should be at, but I tell them they need to be at a comfortable weight. You shouldn't lose a bunch of weight after you have a big body contouring operation because we know skin elasticity is compromised. If you lose a bunch of weight, you'll get a bunch of loose skin and you'll look like you need another body lift. And then obviously you need to be in health. So we check preoperative labs on everyone, and particularly when patients have had bariatric surgery, there's a high risk of vitamin deficiencies and anemia preoperatively. So we make sure that's optimized before we do this. Do you guys have anything else that you do for your patients? Anything that you think is really, really important to kind of help them sail through this process?
I will say, go ahead.
Oh, go ahead. Sorry.
I was just going to say this is all critical. I think even in the best candidates, I tell patients you're going to expect some skin breakdown somewhere. It's never going to go perfectly well everywhere. It's such a big incision. It's such a dramatic, aggressive change. So you're absolutely right. Even a little bit of a problem is going to result in a huge problem afterwards. So I just tell patients you're going to expect some wound healing issues. We're going to have to manage them. I think the malabsorption is a huge issue, and putting patients on supplements is a big thing.
I like to talk to patients about, I refer to this as prehabilitation. So prior to surgery, I want to slightly increase their exercise regimen a little bit, get them walking, get them moving a little bit, and I think that's really important. One other point here, just so we're all on the same clear definition here. According to, the best source, which is Urban Dictionary, snatched is the definition of snatched is a term used to describe someone or something in a positive manner. Snatch means looking good and on point. And of course, they give an example here. Girl, did you see her makeup? Yes, she snatched.
It is, my friend,
amazing.
And the body contouring, particularly in the Brazilian butt lift population, it has the new subcontext has everything to do with their waist, and so maybe Urban Dictionary needs to add to and broaden their definition a little bit, but it has a specific thing for the waist.
You know who's snatched? You know who looks snatched? This guy.
This is kind of embarrassing. Like when you guys,
Thanks, Buzz Lightyear.
I have 2 teenagers. Dr. Rhee, you've got a teenager. When they tell you something and you don't quite get it and the expression they kind of give on their face, that's kind of what I'm doing with Dr. Pacella in this tangent about snatch right now. But there's one more thing getting back on topic here that I want to ask you guys about, and that is, in these cases, the complication that I fear the most, and I know you guys fear the most, isn't wound healing complications. It's blood clots. Blood clots are a profound risk for any large body contouring operation, tummy tucks, and these operations even a little bit more so. How do you talk to your patients about blood clots, and how do you treat your patients for blood clots?
So good question. I first start out by saying that, of any operation of plastic surgery, body contouring, specifically abdominoplasty, is at a slightly higher risk for clotting. And I usually talk about a discussion of bleeding versus clotting. So if you're on blood thinners and you have some bleeding, that's a problem, but it's a solvable problem. Meaning, if you have a bit of bleeding, and it's bruising, sometimes we can just manage that expectantly. If you have a tremendous amount of bleeding, it means a trip back to the operating room. But your cosmetic result won't change, and it won't be a permanent issue necessarily. If you have a clot that's in your legs that dislodges and goes to your heart, that can be invariably fatal. So that's obviously something that's not reversible. So I'd much rather err on the side of bleeding rather than clotting. So what I usually do in my practice in San Diego is if I have a body contouring case, I'll usually start a anticoagulant the day after surgery. And the reason being is I want to make sure that they're not having a hematoma or some sort of intraoperative or postoperative bleeding. And I'll usually start them on a 2-week regimen of something called Lovenox, which is a self-administered shot, usually for 14 days after surgery, but starting the day after. And usually patients are pretty amenable to doing this. It's pretty easy to give it. I have my nurse instruct them on postoperative day number 1 on giving it in the thigh area. And, I think it's usually fairly effective. So.
How about you, Dr. Rhee?
Yeah, most of the places I'm at have actually very strict risk stratification and protocols regarding anticoagulants or blood thinners for these patients. So, you will be giving them just before, during, and after the operation to a variable period depending on their risk factors.
Yeah. And I think that is, those are both very, very well thought out strategies. And mine is similar. The key thing is you need to know if you're having one of these procedures, your surgeon is terrified of blood clots. We are not terrified of bleeding. We know how to make that stop. But blood clots can ultimately be fatal. And like Dr. Pacella said, they're irreversible. So you will be on some form of anticoagulation for some period of time before, during, and after surgery. And with that, let's look at what we did. So in this patient, not much of suspense. We kind of knew I did a body lift on her, so that's in fact what I did. One of the things that I would point out, and the reason I asked Dr. Rhee this question is, when you take the incision circumferential around the patient, you are able to get better delineation of the waist relative to the hips. The incision continues all the way across to the back here. I did what Dr. Pacella had said. I released this upper back area as well, and I did some liposuction as well to defat the area. I also, and that's a topic for another conversation, put some of that fat into the central portion of the buttock as well, to help really change with, to really help sort of give her some more of a dramatic waist to buttock ratio. But this is what I think is possible with a circumferential.
And what can I ask what sequence you did the fat transfer, the Brazilian butt lift with that?
I did it at the very end of the case. So I started off the procedure prone. I did lipo and I did the back portion. I turned her supine and I finished off and did the tummy tuck. And then I turned her prone again and added fat. So lots of position changes in this case. So this was the very last thing I did. One of the things, and again, conversation for another day, but we don't like to put a lot of pressure on the fat. So positioning issues tend to be difficult when you've done that fat transfer. But and as a result, I don't tend to do as much of it anymore as I used to. This is a few-year-old case. But it is possible. It is possible to do it and to get appropriate positioning post-operatively. It just takes a lot of work.
Yeah,
that's a great result. Really good result. You can see, just an hourglass appearance on the back view. I mean, she looked snatched. Definitely snatched.
That's
not a lot of people can do this, Dr. Pacella. I know you can, and Dr. Rhee can. Maybe Henry can, but not a lot of people.
Right.
This to me, this talking about the position changes and the technical aspects of it involved. This is really a team approach. There are moving parts in terms of managing the risk factors. There is a team approach to positioning, to getting the sequence of events right here. This is a dramatic, huge improvement that the patient, what the patient wanted. And this is an aesthetic which in New Jersey I see a lot of, where they want that I can't believe Sal has never heard the word snatch before, but I hear that almost every other day where
Right.
they really want those big hips, that wide sort of lower figure. That no one wants their lateral thighs touched or their anterior thighs touched. They just want that waist, quote, snatched as possible. And the only way to achieve that in this patient is to have done that circumferential, which is very impressive.
Thanks. Yeah. I find these to be satisfying. They do very much require a team approach, but I'm fortunate to work in a surgery center where all we do is plastic surgery. And so we're able to do these very efficiently. And so it's not, I remember in residency, every time you would turn a patient, it was a mind-numbingly slow and arduous process. But in the real world,
I don't think it's pretty efficient. Yeah.
Yeah, it's very different. So.
That's
Well,
awesome.
good. Well, do you guys have any other last thoughts on body lifts or massive weight loss, or any last minute pearls you want to throw at our viewers?
I think it is very satisfying for these patients. I think especially after massive weight loss, they feel that they put, because especially even with gastric or bariatric surgery, the patient has to put a lot of their own effort and time, and it's not magic from the procedure where they lose all that weight. So, there are a lot of failed bariatric patients out there too who did not lose enough weight after their procedure. So for them to have achieved that successful weight loss and then to come to us as plastic surgeons, be it Dallas, be it San Diego, be it New Jersey, and say, I did all this and yet I'm not where I want to be able to finally get them to that goal that they have in their head after all of that effort is tremendously satisfying.
Great.
Got to be snatched. Got to be snatched. I consider myself schooled today. Hashtag schooled.
Well, gentlemen, here's praying that the next time we have a show, Dr. Pacella has fixed his technology issues.
And we can see his handsome face even better than ever after that.
Exactly.
You know what looks snatched right now with looking up at the camera? My neckline. It's snatched right now.
Exactly.
Those bunches of flesh-colored rectangles that I'm looking at right now. Yes, that looks really good.
Yeah.
All right, gents.
All right.
To infinity and beyond.
Have a wonderful weekend, everyone.
Thank you. You too.
Bye.